No doctors, no hospitals, no pharmacies. Imagine living in a world where, if you got sick, there was no emergency room, no antibiotics, no ambulance rushing through the night. For ancient tribes, that wasn't imagination. It was reality. And yet, they survived. In fact, they thrived. They healed wounds without stitches, cured fevers without pills, and treated pain without anesthesia. Their knowledge of nature, plants, herbs, rituals, and even bone setting was so advanced that in many cases, it rivals our modern medicine. This is the secret story of how tribes kept themselves alive, healthy, and strong, long before medical science existed. Think of it as humanity's first hospital, but hidden deep in jungles, deserts, and caves. Long before aspirin, antibiotics, or paracetamol, tribes had something else, the pharmacy of the forest. Every leaf, root, bark, and flower was a potential medicine. Shamans and healers memorized hundreds of plants. Which ones cured fever, which ones numbed pain, which ones stopped bleeding. For example, in the Amazon rainforest, tribes chewed willow bark to ease pain. The same bark that modern scientists later discovered contains salicylic acid, the key ingredient in aspirin. African tribes used aloe vera for burns and wounds. Native Americans used echinacea for infections. This wasn't random trial and error. It was generational knowledge, passed down like a living textbook. Each healer was like a walking pharmacy, carrying cures in their mind. Think about it. While we pop pills from a plastic bottle, tribes brewed teas, made poultices, or even smoked certain plants as medicine. They didn't need lab coats. The jungle was their lab, the earth their doctor, and sometimes their cures worked faster than modern drugs. Imagine curing a fever with nothing but leaves boiled in water. That was their paracetamol. Now imagine this. You're hunting in the forest. You slip on a rock, and your leg bone snaps. Today, you'd rush to the ER, get an X-ray, maybe a cast, maybe even surgery. But for tribes, there were no hospitals, no surgeons in scrubs. Instead, they had bone setters, healers trained in the art of touch. These men and women could feel broken bones with their hands, realign them, and wrap them with bark, vines, or wooden splints. In some tribes of Africa and India, bone setting was a respected, lifelong profession. They didn't just fix broken arms. Some could set jaws, straighten spines, or reset dislocated shoulders. Their tools? Hands, sticks, and intuition. And here's the shocking part. Archaeologists have found ancient skeletons with healed fractures so perfect, it's clear those people received proper care. In other words, tribal bone setters were performing successful orthopedic treatments thousands of years before hospitals. Sometimes they even attempted primitive surgery. In Peru, tribes performed trepanation, cutting a small hole in the skull to relieve pressure after injury. Many patients survived, as the skull bones show healing. Imagine surviving brain surgery without anesthesia. That's how tough and skilled they were. In today's terms, this was the first version of ER trauma care, except instead of metal tools, it was bark, stone, and steady hands. All right, setting bones and doing surgery is one thing, but imagine doing it without anesthesia. No morphine, no injections, no painkillers, just raw, unbearable pain. How did tribes deal with this? Simple. They went straight to nature's pharmacy. Many tribes discovered plants that dulled pain, calmed nerves, or even knocked people unconscious. In South America, tribes chewed coca leaves, numbing their mouths and fighting fatigue. Native Americans used tobacco and peyote to reduce pain during rituals. African tribes brewed strong teas from roots that worked like mild sedatives. And for serious procedures, shamans would sometimes blow powdered herbs into wounds or burn specific plants to make patients inhale the smoke, creating a trance-like state that dulled pain. Some tribes even used alcohol made from fermented fruits to sedate patients before cutting or stitching. Not the most pleasant drink, but it worked. This was the first anesthesia, raw, natural, and surprisingly effective. Imagine a healer whispering chants while giving you a bitter root to chew, and minutes later, your pain fades away. It wasn't perfect. Some patients screamed, some fainted, some never woke up. But in many cases, it saved lives. Today we rely on syringes, IV drips, and anesthetic gas. But thousands of years ago, tribes hacked the same system, with nothing but leaves, roots, and a little bit of faith. All right, picture this. A hunter is injured by a wild boar, or a warrior comes back from battle with deep cuts. Today you'd rush to a hospital, get disinfectant, antibiotics, and clean bandages. But for tribes, there was no penicillin, no antiseptic wipes, no sterile gauze. And yet, people survived. Why? Because tribes discovered natural antibiotics long before scientists gave them names. For example, honey. Tribes across Africa and the Middle East used honey to seal wounds. Its natural antibacterial properties killed infection and kept wounds moist, helping them heal faster. In the Amazon, tree resins were applied to cuts, acting like natural superglue. In Asia, turmeric was used to disinfect wounds and reduce swelling. They also used smoke and ash. Rubbing ash into wounds sounds brutal, but it helped dry them out and prevent bacteria from spreading. Some tribes used spider webs to cover cuts, sticky, absorbent, and surprisingly effective as bandages. And they didn't just treat the injury. They prevented infection through ritual cleansing, washing wounds in rivers, burning herbs around the patient, or applying clay to draw out poison. Think about it. Before antibiotics were even discovered in the 20th century, tribes had already mastered infection control. They turned wounds that could have killed into scars that told stories. Of all human challenges, childbirth was perhaps the most dangerous in tribal times. No hospitals, no incubators, no emergency C-sections. Just a mother, the village, and the will to survive. But tribes had their own solution. Midwives, experienced women who dedicated their lives to guiding mothers through pregnancy and birth. They knew exactly which herbs eased labor pains, how to position the mother, how to cut the umbilical cord with sharpened stones, and how to massage the baby into breathing its first breath. Some tribes used warm water to relax mothers. Others burned herbs to purify the air. Many relied on rituals, singing songs, calling on ancestral spirits, or blessing the child immediately after birth. It wasn't just medicine, it was community. Women surrounded the mother, supporting her with chants and songs. The moment of birth wasn't hidden in a sterile room. It was celebrated as a sacred, communal event. And here's the miracle. Despite no doctors, countless babies were born healthy this way. The knowledge of midwives kept humanity alive for tens of thousands of years, long before modern gynecology. So the next time someone says natural birth, remember, tribes were the original maternity wards, and their midwives were heroes who carried the future of humanity in their hands. Here's the thing. Survival wasn't just about broken bones or fevers. Tribes also had to deal with something harder to heal, the mind and spirit. When someone was grieving, anxious, or traumatized, there were no therapists or psychiatrists. Instead, tribes turned to rituals and community healing. Shamans and spiritual leaders guided people through ceremonies with chants, drumming, firelight, and sometimes hallucinogenic plants that opened the mind. These rituals weren't just superstition. They created a sense of release, connection, and belonging. For example, Native American sweat lodges helped cleanse the body and spirit. African tribes used rhythmic drumming and dance to treat emotional pain. In the Amazon, ayahuasca ceremonies brought visions that gave people meaning and healing. Most importantly, no one was ever alone. When you were sick, the whole community surrounded you, offering care, songs, food, and love. In a way, their therapy was the warmth of family and tribe. Think about it. Today, mental health is treated with pills and therapy sessions. Back then, it was treated with fire, rhythm, and human connection. Different methods, but the same goal, healing the invisible wounds. So, no doctors, no hospitals, no pharmacies, and yet tribes survived. They healed wounds with plants, set bones with sticks, eased pain with herbs, prevented infection with honey, delivered babies with midwives, and healed the spirit with rituals and community. Their hospitals were the jungles. Their medicine was the earth. Their therapists were family and firelight. What's truly amazing is this. Much of what modern medicine uses today, from aspirin to antiseptics, came from the very knowledge tribes discovered centuries ago. We didn't invent healing. We rediscovered what they already knew. In many ways, their survival wasn't just about cures. It was about connection. Healing wasn't private. It was shared. Sickness wasn't weakness. It was a chance for the tribe to come together. So here's the question. If tribes could keep humanity alive without doctors or hospitals, what secrets of survival have we forgotten in our modern world? And maybe, one day when technology fails us, it will be their ancient wisdom that saves us once again.